Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and MediSpa. Today, we're going to discuss post-bariatric surgery and procedures that are available. We're going to talk about the journey and some of the trials and tribulations of going through weight loss, not only just the weight loss surgery, but also the recovery time. And today, I'm honored to have a very special person, Michele Tedder, who is also a patient of mine. But Michele is, as you'll get to know real quickly, she has such a presence and such great energy, but she's taken it to the next level where she kind of took the bull by the horns and has organized not only her own foundation and support group, but it is becoming a national support group. And I'm going to have her discuss why she did it and how you can access it so you can also be helped and get the support that you need, because that's the most important part of the weight loss journey, is to have continuous support as you travel along that road. So hi to Michele, and I'm so happy to have you here, as you and I have become close over the last few months since you've had your surgery. So tell us a little bit about you. You tell us about your nursing background and how you kind of came to how you decided to undergo surgery for weight loss, and go ahead and kick it off for us.
Okay, thank you, Dr. A. I call you fondly Dr. A. So I had weight loss surgery in 2017.
Mm-hmm.
And that was after, I've struggled with my weight my whole life. I was always the chubby kid. And in adulthood, really struggling and doing like all the things that you do to lose weight. You name it, I tried it. But with some success with various programs, but never like what I wanted or long lasting. And so after years of doing that, I started kind of hearing about weight loss surgery. And at that time in Pittsburgh, they weren't really doing the sleeve. They had the band, they had the full bypass, but that was about it. So I looked into doing the band and went through the 6-month process that you have to go through to do the band. And at the time, the PCP that I had was getting ready to do the bypass himself.
Okay.
And so we had talked about it, and he had multiple health issues. And so the last appointment that I had with him, he said he was going to do it. He was scheduled to have it within the next couple of weeks. And so he said to me, "I'll let you know how it goes." Well, he had the surgery, and about a month and a half after his surgery, his practice sent out letters. He had passed away.
Wow.
And so I happened to be working for a physician who was a friend of his, and he had passed away from complications of the surgery. Completely freaked me out. Completely freaked me out. So I was like, oh my gosh, I'm like, I don't know that I want to do this. So anyway, I had gone through the 6 months. They called me and say, "Hey, we've got a surgery date for you." So you know me, how transparent I am. I'm on the other end of the phone going, and so the girl goes, "You sound like you changed your mind." And I'm like, "Yeah, I did." Like I did.
Right.
So she's like, "It's fine. It's okay." She's like, "It's better for you if you change your mind. It's okay." And the other thing is that I'm very much like an input person. And so I do a lot of research about things. And I had been finding people who'd had the band and they weren't really having a lot of success. They were not losing a lot of weight, or they were losing it and gaining it back. So I was like, you know what? I don't want to do this. I'm just going to keep doing what I'm doing. So I kept exercising. I kept, trying different things. So fast forward, my new PCP, who I had built a relationship with several years into this, and she's like, "Michele," she's like, "Please." She goes, "You are doing all the things." And she really sat me down and helped me to understand that obesity is a disease. And she's like, this isn't your fault. This is not like, it's not like you're not trying. It's not like
Right.
you're not exercising. You're the perfect candidate for this. And by that time, they had started doing the sleeve here in Pittsburgh. She had had several patients who had had great success. She's like, you're the perfect candidate because you're doing all the things. So I'm like, all right. And I trusted her impeccably. So I decided to go and start to see this new surgeon, this bariatric surgeon. So I started also doing more research. I started joining Facebook groups. I started asking people who had had it. I would interview anybody who would talk to me, like literally.
Right.
And so 2 years into all of that research and continuing to change my lifestyle and developing, different habits, I got peace about it and I took the plunge in December of 2017.
Mhm.
It was the best decision I've ever made. I've never looked back.
Right.
And so I have 90 pounds
Mhm.
and kept it off. And so fast forward to the whole skin thing.
Right.
And that's where you have entered my life. Because
Right.
one of the things that happens when you have massive weight loss is sometimes you got skin issues.
Right.
And so that has been the next part of the journey. Not a horrible thing, but it is a real thing. And
Right.
so I think, one of the things that you can't control is the elasticity.
Right.
Things sometimes don't bounce back. So that became the next part of this.
Right. I think there's some misconceptions out there as well, but I want to touch on two things that you said before that lead to success. Because when I go and talk to weight loss groups, the first thing I tell them is, this is a tool that will help you gain control of something that you have not had control over. And this is about your health. But you have to change your lifestyle. The surgery isn't the cure for being overweight. It just isn't, but it helps you in a very large way, whatever way that, whatever surgery that you have. So you have to keep that in mind. And you did that, you changed your lifestyle. The other thing is you did your research and your timing and everything else. So you did everything you needed to do. And I encourage everybody to do that, because the timing wasn't right for the first surgery, but it was right for the second surgery, and you met it with great success. The other thing is, a lot of patients have this idea that if they lose weight too fast, then the skin won't retract as much. And that really doesn't have anything to do with the quickness in which you lose weight over what time frame. It's just the elasticity of your skin, and genetics plays a part of that, but also the age in which you do it and how much weight you lose. Those are all factors that really much weigh upon how much skin needs to be addressed afterwards. So I've had patients in their 20s that have lost 150 pounds that look like they've lost 30. But I have patients in their 50s and 60s that have lost 80, 90 pounds, and they've got lots of extra skin. So it really just depends on again, the timing of everything. So, and so you started dealing with that. What sort of kind of brought you to that point where you said, okay, I got to take care of this skin? What was the sort of the progression, or that one final moment that told you, okay, this is it, we're going to have to do something about
So, it started with my arms,
it? Mm-hmm.
to be honest with you. So that you didn't do that
Mm-hmm.
surgery, but I was, I had an enormous amount of hanging skin from my arms. And I was, well, to be honest, I was cooking one day. I love to cook.
Mm-hmm.
And, and I'm short, as you know, I'm only 5'1". And so I was reaching to get some spices out of my spice cabinet, and the skin was hanging, and I
Mm-hmm.
singed it on
Right.
a hot pot. And so I was like, this is not normal. This is not good. And
Right.
so I thought this has to be addressed at this point. And so,
Mm-hmm.
and honestly, I had kind of been struggling with it because when I would go to try on new clothing, as my
Right.
body had because I'm down like 10 or 12 sizes or something. And so um, I would always have to get a little bit larger size in order to accommodate the sleeves. And I
Hmm.
would roll that extra skin into the sleeves. But, there was the issues with other places, it's kind of big, all of that nonsense that
Right.
you go through. So it was like, enough's enough. And honestly, there's always this debate between, have you lost enough? Do you wait a little bit longer? Because
Right.
honestly, to be quite frank with you, I kind of still feel like there's a lot more skin on my arms that I would
Hmm.
like less of that. Um, but at that point, I was just like, I couldn't even live with
Right.
what was there anymore. It was just too much. So
Right.
I think it just becomes, there's the practical side. It became a
Hmm.
practical at that point. So I went ahead and had it done. So there was that piece. Um, and then I met you and we
Hmm.
started talking about the tummy stuff.
Right.
So, and I think it, also I was starting to get with my arms and the tummy, you start to get skin rashes. I
Right.
mean, it just becomes a whole medical mess,
Right.
you
Yeah.
know.
And that's the other thing is, patients start getting these rashes and then, they're trying to control that and some are able to control it and some of them aren't. And so the ones I'm seeing are the ones that are just unable to control it. And it really doesn't have anything to do so much with hygiene because patients are washing and doing everything they need to do. But it sets up a whole different circumstance after the weight loss. You feel better. Everything is improving from a medical standpoint and from a health standpoint. But now you have issues that you sort of didn't know about. And now you're
Exactly.
dealing with something completely different. As you said, you're trying to roll the extra skin in your sleeves, or you're trying to tuck your belly into your pants differently. So it becomes a hassle in another way. And so that's some of the things when I talk to groups about, especially those patients that are contemplating or getting ready to go through it, is to let them know this is going to happen to some degree. And you may or
Mhm.
may not be at a point where you need to take care of it. But if you do, and that's why we put this out there, these are the most common things that people do, and we can go through them and safely. So, and that's where you came in and you said, look, it's just something I just don't want to deal with anymore. It's, and clothing options are a big problem because as you're losing weight, as you said, you're not changing your clothing options. And that can be a little psychologically tough because you're
Mhm.
doing everything you want to do, but you're not getting that result that you really want and deserve.
Exactly. Well, there's a lot of emotional gymnastics along this journey, and I
Hmm.
think that we'd be remiss to not talk about that because I
Right.
think that as you're changing, right? So there is an excitement that is happening because it's like, oh my gosh, like you never thought, because I'm in my 50s, and so you just never thought that you were ever going to be able to reach this, but you've got this new tool that has
Hmm.
now given you the grace to do what you couldn't do on your own, right? And so it's like, oh my gosh, this is so exciting, life changing. But then you're starting and you have in your head what you're going to look like, and so I think
Hmm.
there's some like
Disconnect.
disconnect, right?
Yeah. Yeah.
Somewhere you're trapped in your 20 imagination. You're like, okay, well, am I going to look like I did when I was in my
Yeah.
20s? And the answer is no. So if I'm going to tell you right
Right.
now, like, for those of you in your 50s, no, you're
Right.
not going to, because that train left.
Right.
It's like it left. But are you going to be your best self at whatever age you are? Yes, you can be, I think. So you're dealing with that and you're trying to reconcile all of that. But then there's these very real things that you're trying to manage around. Like I can remember when I had my arm lift.
Mhm.
I seriously, Dr. A, thought, I seriously thought, I'm going to have Michelle Obama arms when I come out.
Mhm.
And I remember going to my post-op visit, and when they removed those bandages, I was like, I said to him, I'm like, where's my Michelle Obama arms? I was really upset. Like I like had serious issues. And I mean, if you talk to my family, if you talk to Robin, you've met my daughter Robin,
Right.
she would roll her eyes and be like, oh my God, like she's driving us
Right.
crazy. Like for months, I really had a real like psychological like breakdown about
Right.
the expectations. And so I think that one of the reasons why I so much wanted to do this with you was I really want my community, social
Mhm.
media, to really have an understanding of what plastic surgery is and what it isn't, right?
Right. Exactly.
Because I think there's a lot of misconception going on out there
Yep.
that, right, because we have a lot of comparison culture.
Right.
And so we're looking at these pictures, and so somebody has plastic surgery and their arms or their tummy or whatever looks like
Right.
this. And so you have this conception that that's what yours is going to look like too. But what you don't know is that your age plays a part, your genetics play a part, where you started, where you are in your journey, all of that matters. And so what I will say, and having had two surgeons, and I'm not knocking the other
Mhm.
at all, so I'm going to preface this, but what I will say you are absolutely a beast at is educating your patients around what to expect.
Yeah.
And so you understand. And so that is the key. And so for people who are watching this, if I had one piece of advice, I would say whatever surgeon you go with, make
Hmm.
sure that he or she is very good at sitting with you and explaining to you based on your individual situation
Exactly.
what you can expect
Right. And
or
that's the
not.
hard part. And we always say in plastic surgery, I mean, we basically have to manage expectations. But I think the problem is that, and it started way back with some of these extreme makeover shows that were on TV, these, what I always call the non-reality reality shows.
Yes.
I think it gives people this false sense of what we can do. And I think I appreciate you saying that about me as well, because I really try to be transparent with patients and try to get people to understand. I don't want people to go through a surgery and then say, well, God, this is nothing like, you told me it was going to be. It shouldn't be like that. It should be real, and let the patient make up their mind if that's something that they want or they think it's their best decision. And I think that's the key to it, is that I want patients to be happy and proud of what they've done, and deserve good things because they've gone through this journey. But I think you have to really work together. The surgeon and the patient have to work together and discuss it. But because there is a lot of social media, and people, we used to call it photoshopping back in the day. Now it's filters, and you don't know
Mhm.
what you're looking at. And so, and as you know, I give out my cell phone number to patients because I would rather patients call me or text me rather than get on social media or Google and look for things, because quite frankly, you don't even know that what you're looking at is real. You don't know if it's a
Yep.
real patient.
Yep.
Doctors put patients on their websites, and they're not even their patients, they're models and different things. And so trying to lure people into it, and that's offensive, that especially
Yes.
being a physician, that it shouldn't be, what I do shouldn't be a sales pitch. It should be,
Mhm.
listen, let's talk about where you're at. Let's talk about, what your expectations are. And can I, as a surgeon, get you to your expectations? Or do we agree that maybe a little bit below what you expect, but, we can do this, and if that's okay for you? But I think that's really important. It has to be, working hand in hand together as a team. So that, at least as best as I can describe to you, what you're going to look like and feel like afterwards. And then the post-op period is
Okay.
walking you through it hand in hand. Because I think people think that plastic surgery, it's funny because I'll have patients that come in and I'll look at their past surgical history and they don't mention anything. They're coming in to see me about a revision of some cosmetic surgery and it's not even listed on their past surgical. And I say, well, it says here you wanted to touch up your augmentation, but you don't even have it listed. Well, it's not real surgery. It was cosmetic surgery. Like, well, it's real surgery,
It's real
or
surgery.
they're dismayed that after surgery they have some pain. I'm like, yeah, because it's real surgery.
Yeah.
But I think that's the misconception is that there's no pain. You have instant healing when you wake up and take the dressings off. There's no scars. You go right back to your lifestyle. And it isn't. It's weeks and weeks of healing and back to things slowly. And then you have some issues like you've had with some spitting stitches that we've had to take out. And, and those are just common things. But and that's why I like to do these Facebook Lives, especially for things like this, because I want to break those misconceptions. I want to be realistic about it. And if that keeps people from coming in saying, well, I don't want to do that, better you find out now than after the surgery, right? I mean,
absolutely. I agree. I agree with you 100%. I mean, I think that there's two things. So the day that I met you, the 1st day that I met you, as you recall, I rolled into your office and I had this whole big, I was like, let's do the mommy makeover. Like, I want this.
Right.
And you looked at me with you're such a kind man. And you're like, whoa. It's like, let's hear about your journey. And then let's figure out what makes sense. Okay. Like where you're at and what you should do, what you shouldn't do. And I was like sold because I thought, wow, this is a man who one has integrity. He's not like here, like listening to me, like all this, like do this, do that. It's like you really, really sat there with me for literally, I think we talked for like an hour or so, and you really wanted to understand me. You wanted to know. You wanted my medical history. You wanted to know my weight loss journey. You really wanted a plan that was going to serve me well. And honest to God, I mean, you've now done 4 of my friends. So,
right. Right.
I mean, seriously, and I'm really like super picky about like physicians. And I'm like, I always laugh. I'm like, this guy, right? I said, I tell all my friends, I said, listen, you all can go to him as long as you all remember that I'm the president of the fan club.
Well, I appreciate it. But again, I think that's important. And because you came in with enthusiasm, which I loved, but that sort of had to be, bridled and taken down the road. And, the old saying, Rome isn't built in a day. And I think we sometimes as surgeons give patients the idea that we can just fix it all. And you can to a degree.
But you didn't do that. And I think that what I think what I most appreciate about our relationship, I trust that whatever it is that I need or don't need, you're going to tell me that. Do you know what I'm saying? Right. And that's what you need in your plastic surgery relationship. Like all this stuff that's showing up on the internet, and it's like the pie in the sky, like, oh yeah, let's do this tummy tuck, let's chop up your arms, stop. Like this is not good. It's not healthy. It's not real. It's not good. It's like this is a medical procedure. And I can tell you from my own experience, we're 6 months into this, right? I still text you, 2 weeks ago, I text like, what's up with these internal stitches? Right. You know what I'm saying? Like they're still dissolving, but yet if you pay attention on the internet, you would think like you have this surgery and like in like a month and a half, all is well and everything is good. And I think that is not true. That's not true.
Good. Well, I'm glad you said that, because that's the biggest thing that I think that I fight is that, patients will say, oh, I saw this and, they were back playing volleyball in 2 weeks. And it's like, well, that just isn't true.
It's not
it just
true.
Isn't. Yeah. So
it's not true. I'm not saying it's horrible. I mean, I'm fine. I'm healthy. I mean, I'm not saying that, but I am saying what you see on the internet, don't believe everything that you see, because what you see
Absolutely.
may not be what you really see.
Right. And you know, and it might be a completely different procedure than what you're having as well. And so, you know, there's degrees of even the surgery that you had, there's different degrees of it, just depending upon what needs to be removed. So, you know, but I appreciate you saying that. Now, I think the part that I really want to get after with you is what we were talking about before. Tell tell our listeners how you got to making, you know, this group, the support group, and you were talking about what's sort of lacking in, you know, the process of weight loss surgery. So tell us about that, because I really want to get that out there for patients to, or potential patients, to be able to either connect with you or
Mhm.
learn the importance of a continued support group, because that's the key. It's not everything before the surgery, it's really
Mhm.
after surgery and the
It is.
ongoing, because it's not, as we talked about, it's not have the surgery on, you know, today and then tomorrow you don't need anybody. That's when you
Mhm.
need people the most. So tell
You
us
do.
about how you came about doing that.
Absolutely. So when I was home recouping, I really felt like I wanted to do something to
And you're
help to
recouping
support
from your gastric
from
sleeve.
my way. I have the sleeve.
Right.
Yep.
Right.
I
But
have
this
the
is the time
sleeve.
frame you were thinking about it when you were recouping from that.
Exactly. That was
Mhm.
the time frame. So it was in December 2017. So I thought, wow, it would be really cool to have kind of a place, a one-stop shop for people to be able to come get some support, be able to like link to articles or be able to, drop in. So I started this Facebook group called Bariatrically Blessed. And so we have probably now about 186 members. And so I post in there, um, eh, you know, probably about twice, two to three times a week, just various things. If I come across articles that I think are helpful, sometimes I'll like post some exercise sessions. I have a trainer, so sometimes he and I are in there. People will post in there if they have questions. But I wanted to have a space for people who were either thinking about the surgery, they'd
Mhm.
had the surgery,
Right.
or just wanted some support around developing a healthy lifestyle. Because honestly, this is a journey. And that's what I keep saying to people. That's my biggest message. It's a journey, it's not a destination. You get the surgery because you need a tool to help you to do what you can't do on your own.
Right.
Obesity is a disease like heart disease, diabetes, anything like
Mhm.
that. Genetics, there's all kind of things that prevent you sometimes from being able to lose weight.
Right.
So being able to have that tool really kind of helps you to be able to set that lifestyle, but you still have to be able to make the changes and you still need to have support. So out of that also came during the pandemic of all times,
Mhm.
um, a group called Let's Talk. And so that's the virtual bariatric support group that I do every Thursday night. And
Mhm.
so people can hit me up on either Instagram or on Facebook because it's by invitation. I do it through Zoom. And people hop in there, and that's where I really get into dealing with all of the different parts of support that you need in order to stay on this journey. So we talk about exercise, we talk about nutrition, we talk about spiritual wellness. I mean, all the pillars of wellness that it takes,
Mhm.
because I feel like this is a mind, body, spirit journey.
Right.
And so I really pick topics to help people to really take a look at that, because if you don't deal with all three, you're not going to be
Right.
successful for the long haul. And if you think that it's going to be like, oh, I'm going to do this for a couple of months and I'm good, not going to work. It's not
Right.
going to. So,
Yeah, and that's amazing, because I think that I've said for years is that I think all of the insurance money, all the insurance stuff is put in the forefront. You know, it's all leading up to the bariatric surgeon. or the surgery, but there's really nothing afterwards. They don't pay for support groups. They don't pay for any type of tune-ups that you might need, other than your medical primary care physician. But there's just nothing on the back end. And you brought up a good point. If you have high blood pressure or heart disease or diabetes or kidney disease, you're seeing your cardiologist, your primary care, your kidney doctor at least several times a year.
Yeah.
There's not really, realistically, after you have your surgery, you don't see your bariatric surgeon too much afterwards. It sort of falls back on the primary care physicians. And I think that's where we sort of are lacking in this field, is having people that really understand what happens in all of the surgeries. The band is not an issue anymore, but there's still people with the band. There's people with the gastric sleeve that's become so popular. The old-fashioned gastric bypasses, the new gastric bypasses, because I was doing that in my training in the 90s. These old gastric bypasses. Those patients are still around, and we still need to understand them. But I think we're lacking there. But the fact that you've done all of that is a tribute to who you are and your personality. But it says a lot about what you found as a very outgoing, intelligent person who does a lot of research, and having your nursing background to say, look, you know what, I've tackled this, but it's ongoing, and I'm trying to make it better for everybody else to understand that. And so, like you said, there's no one area. You were saying before that there's information out there, but really spending the time to sit down and try to pull it all together. So you've sort of done that. You've kind of cut out all of that wandering around the internet and put it in one area that patients can really find you. So how do they get to you and your support group?
So they can reach me on Instagram. It's at Coach Tedder. Because the other thing is I'm a certified lifestyle coach too. I don't know if I ever told you that.
I didn't know that.
So that's another one of the tools in my toolbox. They can go to my website, which is bariatricallyblessed.com. They can reach me there. And also, if they want to join the private Facebook group, it's the same name, Bariatrically Blessed, on Facebook. And they can hit me up as Michele Tedder, and it should come up in there too as well. So they can reach out to me multiple ways. And I also do coaching for people who want to go a little bit deeper. They can, talk to me about doing that. So
that's fantastic. That's incredible. So, but this was enlightening for me, and I know it's going to be enlightening for everybody else. And I've been doing this a long time. So I'm going to talk to Ella here about let's have another one of these within the next 6 months, as you get out to almost a year, and talk about it some more, and with your journey, because I really want you to be able to reach as many people as you can.
I would like to, and I'm actually planning, Dr. A, to kind of expand services, because there's just a lot of work to be done. And as I'm doing the groups, because the group is free, the Let's Talk group is free, but I'm finding that there's just a lot of people who, like you said, on the front end, they are getting what they need in the prep, but afterwards, there's not a lot of aftercare. So one of the things that I really want to expand into is maybe being able to work with some of the bariatric practices to partner with them to offer some of these kind of services, because people should not be out here thinking that they're going to be able to have long-term success. Like, I have a girl in my group now, she's gained almost all of her weight back.
Yeah.
So do you know what I mean? I mean, that's just heartbreaking. It's so hard. And I don't want to see people having to deal with that. I know you can't prevent everybody, but I just believe that if you have enough tools in your toolbox, that doesn't have to be your story.
Right.
So.
Well, I'll tell you what, I'll go right now and tell you that let's get together, because I'd love to help you do that and get it out to some of these bariatric groups that I'm working with, and the surgeons that I know that I work with too. So we'll get that out there. So we're going to get ready to end our time limit here on Zoom,
Sounds
but
good.
I'll see you shortly in the office. But thank you again for doing this. And thank you everybody for listening. I hope this was very helpful, but please check out Michele Tedder's information and her website and Facebook. I think you'll get to know her and love her as much as I do. So we'll get together again next month. So hopefully everybody has a good month from now until then, and we'll see you at that time.